Vaccine-resistant malaria. What is malaria? Malaria definition, also called paludism, life-threatening disease caused by parasites that are transmitted to humans by the bite of infected female mosquitoes of the gender Anopheles. It is a preventable and curable disease. Malaria vaccine. The RTS vaccine, also known as Mosquirix, is an injectable vaccine that provides partial protection against malaria in young children and is being evaluated in sub-Saharan Africa as a complementary control tool that could add but not replace to the basic package of preventive, diagnostic, and therapeutic measures recommended by the OMS. Resistant malaria. Currently, thanks to very detailed studies in population with malaria and control studies of genomic association can be conducted to find new resistance to malaria. They consist of finding certain change in the genome that may indicate that this change is associated with resistance to malaria. Application in medicine. Symptoms. Malaria is an acute febrile illness. In a non-immune individual, symptoms usually appear between 10 and 55 days after the bite of infected mosquito. It can be difficult to recognize the malarial origin of the first symptom, fever, headache, and chills. If not treated in the first 24 hours, Plasmodium falciparum, malaria can be aggravated, often leading to death. Malaria in Ecuador. Compared to Africa and Southeast Asia, which report high mortality rates due to malaria, only 800 people died in Latin America and the Caribbean in 2015. Although the figures are very good in the continent, and in 55 of the countries, 35 countries of America never had malaria or eliminated it many years ago. There are still 25 million people at high risk of contracting the disease. In 7 of the countries that still have cases of malaria, including Ecuador, the last steps are being taken to eliminate this disease. Conclusion. Malaria is a very old disease which has not been eradicated. Decade interventions to control malaria are fast and effective treatment with combination of artemisinin-based drugs. That is why it is important to provide good primary prevention to transmit adequate information to the population so that the rate of malaria morbidity does not continue to increase.